Miss Sellers.
Hello.
My name's Birgit, and I'm going to be your nurse practitioner today. So what brings you in?
I have some ankle pain in my right ankle.
Okay, right ankle pain. All right, well, I'm sorry to hear that you're having some problems. Since it's your first visit into this clinic, I'm going to do a complete head-to-toe assessment on you. Be asking you some questions, also doing a physical exam. So if at any time we need to take a break or you get tired, just let me know. We can adjust the temperature and take a break. All right?
Okay.
All right, mind if I have a seat?
Sure.
All right. All right, I'm going to start by asking you just a few questions, okay?
Okay.
So you said it was right ankle pain.
Mm-hmm.
When did this start?
Yesterday.
Yesterday, okay. And do you remember doing anything?
I tripped over a rock.
You tripped over a rock. Were you outside at your house?
Yes.
Okay. Can you tell me, is the pain constant or does it come and go intermittently?
It's constant.
Show me on your ankle exactly where it's hurting.
Just right around the bone area.
Okay. Are you able to walk on it?
Yes.
Does it hurt when you walk?
A little bit.
Okay. Are you doing anything for the pain?
Yes, I take ibuprofen, the over-the-counter.
Okay.
2 tablets as needed.
Okay, just over-the-counter ibuprofen. All right. How would you rate your pain in your ankle before you took your pain medicine?
About an 8.
An 8 out of 10. Okay. And after you take the ibuprofen, how does it feel?
About a 4.
About a 4 out of 10. Okay. You doing anything else for it?
No.
Elevating it? Any ice?
No.
Okay, you haven't wrapped it up or anything?
No.
Okay. All right. All right, well, I'm going to ask you some history questions just to get a little health history from you, okay?
Okay.
All right. So can you tell me when the last time it was that you went to see a doctor or had an exam?
About 3 months ago.
Okay. 3
I had
months.
a medical checkup and pap smear.
Okay. Do you have a regular doctor that you see?
Yes.
Okay.
Crystal Jones and Gun Barrel.
Okay, Crystal Jones and Gun Barrel. All right, when was the last time that you had a dental exam?
About 6 months ago.
Okay, and a vision?
About a year.
Okay. Do you wear any glasses or contacts?
No.
Okay. You take any medications?
Just the ibuprofen, and then for seasonal allergies, Zyrtec.
Okay.
Over the counter.
Over the counter. Just how many, what's the dosage on that Zyrtec? Is it once a day?
Yes.
Okay. All right. Okay. All right. And do you, are you allergic to any medicines?
Penicillin.
Okay, penicillin. And what does it do to you?
I break out in a rash.
Okay. Any food allergies?
No.
Any allergies to latex or anything in the environment?
No.
Okay. All right. That's good. That's good. Okay. Any surgeries or hospitalizations?
I had, at the age of 16, my wisdom teeth removed.
Okay.
And then I had an appendectomy at the age of 8.
Okay. All right. And are your immunizations up to date?
Yes.
So childhood ones are all up to date?
Yes.
Do you remember your last tetanus shot?
About a year ago.
Tetanus shot a year ago?
Yeah.
Okay. How about a flu vaccine?
No.
Okay. And coronavirus?
No.
Okay. And tell me your birthday.
1/13/98.
Okay. All right. I'm going to check your long-term memory. Can you tell me the names of the last 2 presidents?
Trump and Obama.
Trump and Obama. And who's our current president?
Biden.
Biden. Okay. All right. I'm going to ask you to remember 3 things for me, and I'll ask you at the end of the exam if you can recall them, okay?
Okay.
Let's see. Let me try to think of them. Yellow, daffodil, and swimming pool.
Okay.
All right. Okay, let's see here. So you said that you just take the over-the-counter Zyrtec. Any other medicines that you take?
No.
Okay. All right. Going to ask you some family history questions. Anybody in your family have a history of heart disease?
No.
Stroke?
No.
Cancer?
Yes.
Okay.
My grandmother on my mother's side had breast cancer.
Okay. Your grandmother and your mother's. Is she still alive?
No.
Okay. How old was she when she passed away?
77.
77, and it was breast cancer?
Yes.
Okay. Any diabetes?
Well, no. On my dad's side, his father, he has
Okay.
type 2 diabetes.
Okay. All right. Anyone with seizures?
No.
Any psychological disorders?
No.
Okay. Any genetic disorders?
No.
Okay. And I said heart disease, right? And I
Yes.
said stroke. All right. Do you have any siblings?
No.
Okay. Your mother, she's still living?
Mhm.
How old is your mother?
She's 53.
And any health problems?
No.
Okay. Father?
Yes, he's still alive.
How old is your father?
48.
48. Any health problems?
No.
Okay. And you said that your maternal grandmother died at 77 of breast cancer.
Yes.
How about your maternal grandfather? Is he still living?
Yes.
How old would he be?
77.
Okay. And any health problems?
GERD.
GERD. Okay. Paternal grandfather, is he still alive?
Yes.
All right. Any health problems?
Just the type 2 diabetes.
Okay. And how old is he?
73.
Okay. And your paternal grandmother?
Yes, she has asthma. She's still living.
And how old is she?
She's in her 70s,
Okay.
about 70.
All right. And are you married?
No.
Okay. Do you live alone?
No, I live with my fiance.
Okay. You have any children?
No.
Any pets?
No.
Okay. Do you work?
Yes.
What kind of work do you do?
I'm a secretary for my stepfather, and I'm a full-time student.
Okay. Any occupational hazards?
No.
Any financial concerns?
No.
Okay. Do y'all live in a house?
Yes.
Okay. And you live out in the country or in the city?
Country.
Okay. All right. You live in the country. All right. Very good. And let's see here. You have health insurance?
Yes.
Okay.
I'm covered under my mother's because I'm a full-time student.
Okay. All right. Full-time student. And you have health insurance. Okay. Do you have any hobbies?
Dance.
Okay. All right. And how about your sleep?
It's fine.
Okay. Do you have any problems going to sleep?
No.
Any problems staying asleep?
Mm-mm.
Okay. About how many hours a night do you get?
About 8 to 10.
Okay. You use any tobacco products?
No.
Do you smoke?
No.
Oh, I'm sorry. I just asked you about tobacco products. Do you drink any alcohol?
Maybe once or twice a month socially.
Okay. And use any illicit drugs?
No.
Okay. All right. I think we've pretty much covered all of that. Anything else you want to add to it? Okay. All right. Now I'm going to ask you some questions just to review your systems, just kind of see how you're doing right now. Any recent night sweats, fever, chills, body aches?
No.
Okay. Tell me about a normal diet for you. What's normal?
Breakfast, lunch, dinner.
Okay. Do you eat any special foods?
No.
Okay. All right. Do y'all eat out or cook?
We cook most of the time.
Okay.
Eat out every once in a while.
You drink any caffeine?
Every so often.
What do you drink? Coffee, tea, Cokes?
Soda.
Okay. You drink any water during the day?
Yes.
About how much?
Maybe 4 to 5 bottles of water.
Okay. 4 to 5 bottles of water. Any exercise?
Yes, I run or walk 1 to 2 miles a day.
Okay. All right. Have you noticed any changes in your skin color?
No.
Any rashes or thickening of your skin? Any moles that have changed color?
No.
Okay. Any unusual hair growth or hair loss?
No.
Your hair's not brittle, falling out?
No.
Okay. Any changes in your hair color?
No.
How about your nails? Any easily breaking? Any problems with them?
No.
Okay. Have you had any dizziness, vertigo, loss of consciousness?
No.
Okay. Headaches?
No.
Okay. Any problems with your eyes? Excessive tearing, blurred vision, drainage, redness?
No.
Okay. Any problems with your hearing? Any ringing in your ears, vertigo?
No.
Okay. Any drainage from your nose? Any problems snoring?
No.
Any smelling problems?
No.
Okay. Any lesions inside your mouth? Any problems chewing or swallowing?
No.
Any bleeding gums?
No.
Okay. Any changes in the color of skin on your neck? Any lumps on your neck or thyroid problems?
No.
Okay. Any shortness of breath?
No.
While exercising?
No.
Okay. Any exercise intolerance?
No.
Okay. Any cough, sputum production?
No.
Heart palpitations or chest pain?
No.
Any lower leg edema or changes in the color of your lower legs?
No.
Okay. Any nausea, vomiting, or diarrhea?
No.
Changes in your bowel habits?
No.
Any blood in your stool?
No.
Any acid reflux?
No.
Okay. Have you noticed any weakness in your hands or feet, dropping things or tripping?
No.
Any joint pain?
No.
Okay. Any problems urinating?
No.
Any blood in your urine?
Mm-mm.
Okay. What age did you get your first menstrual period?
13.
Okay, age 13. Are your menstrual cycles regular?
Yes.
Have any excessive bleeding or cramping?
No.
Okay. When was your last menstrual period?
About 2 weeks ago.
2 weeks ago. Are you sexually active?
Yes.
Do you have more than one partner?
No.
Okay. All right. Do you do breast self-exams?
Yes.
Okay. Any drainage from your breasts? Any abnormal lumps?
No.
Any lesions?
No.
Okay. Any pain in your legs when you walk?
Mm-mm.
Any swollen lymph nodes?
No.
Okay. Any symptoms of anemia? Any wounds that won't heal? Do you bruise easily or bleed easily?
No.
Okay. Any increase in your hat or shoe size?
No.
Okay. Any problems, increase in thirst or hunger or urination?
No.
Okay. Any problems concentrating or with sleep?
No.
Okay. Do you have any thoughts of harming yourself or others?
No.
Any visual or auditory hallucinations?
No.
All right. Anything else you want to add?
No.
Okay. All right. Let's start with the physical exam. All right. Need to take a break or anything?
Nope.
Okay. I'm going to start by looking at your hands. Okay. Your fingernails are clean and there is no polish on them. They are cut short. Your capillary refill is less than 2 seconds. Your cuticles are intact. There's no breakage. There's no drainage or lesions. Squeeze my hands. Got good grips. All right. Can you take your fingers and put them together? All right. I'm not seeing any clubbing. All right. Can you take your fingers and touch your thumbs? All right. And hold your arms out in front of you. Raise them above your head. Hold them out from, okay, down by your side, and then bring them back down. Okay, very good. All right, your skin is pink and warm to touch. I'm not palpating any masses or lumps. There are no lesions or anything on your skin. You have a tattoo on this left forearm, and you have 2 on your right forearm. Let's see. Your radial pulses are palpable, and they're 2+. Your brachial, palpable 2+. There is, I'm not feeling any of your epitrochlear nodes. Okay. And go ahead and try to push out on my hands, all right, and then try to squeeze in. All right, good strength there. Okay. If you did have any lesions, I would take a sample. I'd look at it under a microscope. First, I'd look at it with a magnifying glass, see if there was any exudate, note the color, odor of those. Okay. All right, now I'm going to move on to your head.
Okay.
Oh, actually, what I want to do is check for sternocleidosis. I need you to close your eyes. I'm going to place an object in your hand, and I want you to tell me what you think it is, okay?
Okay.
All right. So this will be your left hand.
It's an eraser.
Okay. Keep your eyes closed. I'm going to place an object in your right hand.
It's a paper clip.
Okay, good. Sternocleidosis is intact. All right. Now I'm going to move on to your head. Your head is normal cephalic in shape. It sits evenly on your shoulders. Your face is pink, and color is proportionate with your arms. All right. May I touch your head?
Mm-hmm.
All right. Your hair looks clean. I'm not seeing any knits. It's soft and fine to touch. It's dark brown. It looks like you color your hair. It is clean. There doesn't appear to be any breakage. It's soft. It's not brittle. All right. I am not feeling any masses or any abnormal lumps. There are no lesions visible on your forehead. Okay. I am going to, your eyebrows are evenly distributed and they're dark brown. Okay, look straight at me. Your eyelashes are also evenly distributed and they turn outward and upward. All right, I'm going to palpate your sinuses, your frontal sinuses. Any pain here?
Mm-mm.
Okay, and your maxillary sinuses, any pain?
No.
If there was, I would transilluminate them. All right, I'm going to check your lacrimal ducts. Okay. Any tenderness here? Pain?
No.
All right, and there's no drainage. They're intact. All right, look straight at me. All right, your sclera is white. Your conjunctiva is pink. I'm not seeing any drainage or redness. Okay. I am going to, if you'll just look straight ahead, I'm going to look at your sclera. Your iris and your cornea and sclera is shiny and clear. Shiny and clear on this side. Okay. If you'll just look straight ahead, I'm going to check your corneal light reflex or your Hirschberg reflex. Okay. And it is intact. All right. Just look straight ahead for me. There we go. Pupils are equal, round, and reactive. All right. If you'll look over my shoulder, look straight ahead. All right. Keep looking straight ahead. Accommodation is present. Okay. Now I'm going to check for your 6 cardinal fields of gaze. All right. So if you'll just follow my stick here with your eyes, not your head. Okay.
Okay.
All right. Good. Those cranial nerves are intact. All right. Now then, I need you to touch your finger to your nose, and then touch mine. All right. And then take your other hand and do the same thing. All right. Very good. Now I'm going to check your strength in your wrists. If you'll hold your hands up for me, bend your wrists forward and back, and then from side to side. Okay. And then also I need you to do some rapid alternating hand movements. Okay. Very good. All right. Now that I'm going to move on, and I'm going to check your, do the cover uncover test. Check for nystagmus. There's no nystagmus present. Okay. All right, now I'm going to look inside your eyes. Doing okay?
Yep.
All right. All right, it's a little bit of a bright light. Okay?
Okay.
All right, red light reflex is present. I'll look at it from the side at an angle. I'm able to visualize the sclera is white. There are no tortuosities. The vessels are intact. I can see the retina and the optic disc. All right. Red light reflex is present from an angle. I'm able to visualize the vessels. There's no tortuosities. Optic disc and retina are visualized. All right, very good. All right, we're going to move on to the ears. Okay. All right, your ears look even and set on your head. I'm not seeing anything abnormal. There's no drainage, no lesions. As I feel them, I'm not palpating anything abnormal. There's no masses, lumps, anything. You have ears on, you have 2 piercings on each ear, and I do not see any drainage or cresting. If I did, I would take a sample, look at it under the microscope, note any color, odor, and exudate. All right. If you would, I'm going to perform the whisper test. If you'll put your finger in this ear, and I'm going to whisper something to you.
Black cat. Yellow daisy.
All right, whisper test is good. And what I'm going to do next is the Weber test. I'm going to hit the conduction fork and the tuning fork, and I'm going to place it on the top of your head. And I need you to tell me which ear or ears you hear best in. Okay.
Okay. Both.
Okay. Now I'm going to do the Renee test. This tests bone conduction and air conduction. I'll tap the tuning fork and I'll place it directly on your skin behind your ear. And then you tell me when you can no longer hear it. And then I'll place it just beside your ear and you tell me when you can no longer hear it.
Okay.
All right.
Okay. Okay.
All right, now we'll do the other side.
Okay.
All right, bone conduction is half of air conduction, which is normal. All right, now I'm going to look inside your ears. All right. Tympanic membrane is visualized. It is pearly gray, shiny. The cone of light is present at the 5 o'clock position. The bony structures are visualized. There's no redness or drainage. I'll do this side. Tympanic membrane is shiny pearly gray. There's no redness or drainage. Cone of light is present at the 7 o'clock position. Bony structures are visualized and no abnormalities are detected. All right, very good. We're going to move on now to the nose. Oh, excuse me. I need to check your temporal arteries. So I'm going to palpate them first. Okay, they're 2+. And I'm going to listen to them with the bell of the stethoscope for any bruise. All right, no bruise hurt. We're going to move on to the nose. All right, your nose looks even and symmetrical. I'm not seeing any deviation in the septum. There's no lesions or abnormalities. Sores noted. I'm going to palpate it. Any tenderness here? Okay. All right. Would you occlude this nostril and sniff for me? Okay, do the other side. Okay, doesn't appear to be any occlusions. Now I'm going to look inside your nose. Just to look up for me. All right, The turbinates are pink. There's no signs of bogginess. There is no drainage. No deviation. I know it tickles. Clear, pink turbinates, no bogginess, and no deviation. All right, one thing that I need to go back and look at is, I didn't look here. The sclera are white and the conjunctiva is pink on your eyes. Okay. All right, next I'm going to move to your mouth. Okay. All right, your lips appear even and symmetrical. They're pink and moist. Okay, can you open your mouth? All right, let me get my light where I can see here because I want to look at the, all right, so if you can open your mouth and say ah. Okay, uvula is midline and it raises when you say ah. I'm not able to visualize the tonsils. Can you lift your tongue up and then down? Move it from side to side. Okay, I'm not seeing anything abnormal there. Let me put some gloves on and should have got larges. Gloves. Okay. Just want to look at your palate, a hard and soft palate, and feel inside your mouth. Yeah, no, I should have gotten some large gloves. Okay, you'll open your mouth for me. All right. I'm not seeing, lift your tongue up. Dentition's intact. All right, no lesions or sores on the inside of your lips. Okay, open wide, please. All right. Hard and soft palate are palpable. Sorry about that.
That's okay.
Okay. All right. Now, if you would, press against my hand here. All right, and then this one here, and then resist me here. All right, you've got good movement there. All right, can you raise your, okay, good. Good shoulder strength. All right, if you'll sit on the edge of the bed, I'm going to check your thyroid. All right, just look straight ahead. Okay, thyroid is palpable. Not feeling anything abnormal. Can you swallow? All right, turn your head to the right, please. All right, and to the left. Very good. All right, go ahead and sit back. All right, now I'm going to palpate your nodes, cervical nodes, lymph nodes, excuse me, not cervical nodes. All right, I'll start with your preauricular, postauricular, occipital, all right, tonsillar, submandibular, submental, all right, and this is anterior cervical. Can you turn to the, turn your head to the left? Okay. Post-cervical, turn your head to the right. Post-cervical, all right. And if you'll shrug your shoulders and leave them there. All right, no supraclavicular. All right, no palpable lymph nodes. Okay, now palpate your carotid artery. 2+ bounding on both sides. Now I'm going to listen for any bruise with the bell. I'm also going to listen to your thyroid, so just breathe normal. Very good. All right. Now we're going to move on to the lungs, okay? All right, if you'll stand up for me. All right. Looking at the anterior chest, I'm not noting any deformities. I don't see any difficulty with breathing. You're breathing normal, no shortness of breath. All right, I'm not feeling anything abnormal in the shape of your chest. Turn around to the back as well. I'm not feeling any abnormal lesions or masses. And if you'll just stand there, your diameter is, AP diameter is 2:1, which is normal. All right, I'm going to check for tactile fremitus. So if, as I move my hands, if you'll say 99.
99, 99, 99, 99.
All right, next I'm going to check for egophony. So as I move my stethoscope over your back, I need you to say E.
Okay. E, 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 E.
Okay, egophony is normal. All right. I am going to auscultate your lungs. If you take a deep breath for me. Okay. if you raise this arm, deep breath. Okay, now the other side. Very good. Now I'm going to percuss. Very good. All right. So turn around and have a seat. I need to check your reflexes that I didn't check, so I'm going to check those real quickly. All right. This will be your triceps. Okay. And now your biceps. Okay. Brachioradialis. Okay. And on this side, just rest your arm. Okay. Brachial and brachioradialis. All right, very good. Sorry about that. Okay, I'm going to listen to you from the front now. Let me check your skin turgor first. So right above the clavicle. And it's brisk return. So we have good in turgor. Turgor is intact. Deep breath. Very good. All right, if you'll lay down for me, we're going to move on to the abdominal portion. Okay. All right, I'm going to raise your shirt up. Okay, you have a ring in your belly button, and I don't see any redness or any drainage. If there was, I would look at it with my magnifying glass. I would note any exudate, color, odor, but there's not anything there. You also have a tattoo here on your flank, on your side there. Okay, I'm not able to visualize any abnormalities, no masses or anything. Can you raise your head up for me? All right, I don't see any masses or anything, any protrusions. Okay, I'm gonna listen to your belly, bowel sounds. You also have a tattoo present here on your left lower abdomen. Your bowel sounds are normal active. Okay, I'm going to percuss your belly. Tympanic sounds are heard in the air-filled areas and dullness over organs. All right, I'm going to listen to heart any vascular sounds. I'm going to start with the aorta, the bell of my stethoscope for any bruise. Okay, renal. Iliac. And femoral. Okay, I'm not able to hear any bruits. That's good. I'm going to palpate your femoral arteries. And they're palpable. And I'm also going to feel for your inguinal nodes, okay? Any pain here?
No.
All right. And inguinal nodes are not palpable. Now I'm going to palpate your, lightly palpate your abdomen. To feel for any masses in a serpentine fashion. You okay? Any pain?
No, no pain.
Okay. Now I'm going to do it deeper. Any pain?
No.
Did not feel any masses or any pain. I'm going to do the scratch test. And that's going to check for the borders of your liver. That's about right there. Which is about 2 centimeters, and that's about normal. Now I'm going to see if I can palpate your liver, okay?
Okay.
So I'm going to place my hand underneath here, and I want you to take a deep breath, and I'm going to try to sweep the liver. All right, so exhale. Not able to palpate the liver. Next, I'm going to try the spleen. Okay, put this hand here, and take a deep breath. All right, and the spleen is also not palpable. Okay, I need to go to the cardiovascular portion. Okay, so while you're lying there, I'm not able to observe any heaves or lifts. I'm going to palpate for the point of maximal impulse, which is at the 5th mid-clavicular space. Okay, I'll listen to the apical pulse for 1 minute. Apical pulse is regular at 68. Now I'm going to listen to heart sounds with the bell of my stethoscope. All right, aortic is right sternal, second intercostal space. Pulmonic is left sternal border, second intercostal space. Erb's point, left sternal border, third intercostal space. Tricuspid, left sternal border, fourth intercostal space. And mitral, 5th midclavicular, left sternal border, 5th midclavicular, intercostal space. Okay, now I'm going to listen with the diaphragm. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, very good. All right, now we're going to move on. I'm going to look at your lower extremities, okay? So if you don't mind, I'm going to pull these up. I don't see any discolored skin. I'm not able to feel anything abnormal, no masses or lesions. Your skin is warm to touch and pink. You have tattoos on tops of both of your feet. Your posterior tibial pulses are palpable 2+. Your dorsalis pedis, palpable at 2+. Toenails are pink, painted, so we'll check the capillary refill on the sides, and it is good and brisk. Okay, all right, can you press down on my hands? All right, and then flex your feet back towards you. All right, good. All right, I'm going to check for any DVTs. So as you push up against my hand, you feel any pain in your lower leg?
No.
On this one? All right, no pain there. Okay, next we're going to do some range of motion. Okay?
Okay.
All right, so I want you to, we're going to bend this leg up. Any pain here?
No.
Can extend it out?
No.
All right, can you press down on my hand? All right, good. Can you press against my hand? Very good. All right, so no pain here.
No.
Okay, very good. Same thing here. Press down on my hand. All right, then press against my hand. Very good. All right, no pain.
No.
All right. Okay, I'm going to check the Lockmans now. Okay, and that tests the integrity of the ACL. So I'm going to, let me know if this hurts, okay? Okay, I'm going to do the other side.
No.
Okay, all right, go ahead and sit up on the edge of the bed for me. We'll do the rest of the exam that way. All right, so it's the right ankle that's bothering you.
Yes.
Okay, so we're going to check the left one first, okay? We're going to do the left. I'm going to go ahead and do the anterior and posterior drawers. That checks for the integrity of the ACL and the PCL. So this is anterior drawer, any pain?
No.
Posterior drawer. All right, we're going to do the McMurray. Any pain here?
No.
Okay, McMurray is good. Apley's, any pain? All right, very good. All right, I'm going to go ahead and check the reflexes. All right, popliteal and Achilles. All right, and Babinski. Babinski. Ticklish there, huh?
Mm-hmm.
All right, now we'll go to the side. Okay. All right, anterior drawer, any pain?
No.
Posterior?
No.
Okay, we're gonna do McMurray's. All right, any pain?
Nope.
All right, and now I'm gonna touch this ankle. Is it tender?
A little bit.
Okay, all right, I'm gonna do the Apley's. Any pain?
No.
Okay. All right, very good. Now we're gonna check your reflexes. All right, good. And Achilles. All right, and Babinski. All right, very good. Are you able to stand up on your leg?
Yeah.
Okay. I'm going to check your Romberg's. So if you'll close your eyes and hold your hands out in front. All right. Romberg's is negative. Okay. Can you do a deep knee squat for me? All right. Very good. Now then, can you walk forward for me? All right. Can you walk back on your tippy toes, or does that hurt too much on your ankle? Okay. And then can you walk forward for me on your heels? How's the ankles? Okay?
That's fine.
Okay. All right. Any pain in it?
A little bit.
How would you rate that?
About a 4.
Okay. All right. And if you'll, can you turn from side to side? Okay. Can you bend back? Bend forward? Okay. Good spine. All right. If you'll turn around. I'm not seeing anything abnormal in your spine. Bend all the way forward. Spine appears intact. I'm not seeing any signs of scoliosis if you'll stand straight up. All right, and visualizing here, there's no signs of lordosis or kyphosis. Okay, all right. Can you remember those 3 things I told you?
Yellow daffodil swimming pool.
Very good. All right, go ahead and have a seat. All right, I think we're done. I think what we need to do is probably get an x-ray of your ankle, and maybe we just need to just keep minimizing it, maybe just a sprain, but we'll get an x-ray of it and just kind of look at it and see where we go from there, okay? Anything else I need to ask?
No.
Or questions? Anything I've forgotten? All right, thank you very much.
Thank you.
All right.